Our mission as pharmacists can be summed up in one sentence. We want patients to take the right medication at the right time. In our world, it's called medication adherence, and today we'll show you how it gets calculated. There are many ways to measure medication adherence, but we're going to focus on the method developed by the Pharmacy Quality Alliance. This also happens to be the method adopted by Medicare for their Star Ratings program. It's called proportion of days covered, or PDC, and this calculation tells us if our patient is taking his medication on time. Take Sam, for instance. He is diagnosed with high blood pressure. He starts taking his medication on March 1st, and he receives a 30-day supply and gets his refills right on schedule, April 1st, May 1st, then June 1st. But by July, Sam starts to feel better and begins to take his medication whenever he feels like it. He lets 10 weeks go by before picking up his next refill on September 15th. When he arrives, Sam's pharmacist talks to him about the importance of taking his medication daily. From that point on, Sam picks up his refills like clockwork, October 15th, November 15th, and December 15th. So is Sam adherent? Let's do the math. First, let's calculate the number of days in our measurement period. We start from the index date. In this example, it's March 1st. That's when the medication was first filled. March 1st through December 31st is a total of 306 days. That's our denominator. Now let's count the number of days he had medication. Sam's pharmacist filled 8 30-day fills. At first glance, you may think that's 240 days covered. But wait, let's look closer. Sam filled his script March, April, May, and June, and then again in September, October, November, and December. December's refill lasts until mid-January, but all the days beyond the end of the measurement period don't count for this calculation. So Sam had his medication for a total of 227 days, not 240. 227 divided by 306 equals 74.2%. So is Sam adherent? Unfortunately, no. The threshold to be considered adherent is 80%. This is the accepted threshold based on scientific evidence that links medication adherence with improved clinical outcomes. Since he falls short of that, he is considered to be a non-adherent patient. So why is this calculation so important? Now that you understand how medication adherence is calculated, you can identify individuals who need your attention and help these patients get back on the right track.